Hi, good afternoon. This is Shay Cunningham. Come to you. We're going to be talking about the Transtheoretical Model. Like last time when we discussed the health belief model, I want to first state if you hear a cat screaming in the background, she's fine. No animals are hurt during the filming of this video. I also want to state if my affect is not as boisterous as it usually is. I'm a little bit in a Benadryl haze. It's to counteract a treatment that I had earlier this week, some of the side effects. So it has nothing to do with the material because I very much enjoy it. I'm going to pull a George Costanza and say, it's not you, it's me. So with that being said, we're going to go ahead and move into our discussion of the Transtheoretical Model. Give a little bit of an outline of what we're going to discuss today. We're first going to go over the background and history, as well as key definitions and concepts. Then we're going to move into the 5 constructs, which are the stages of change in this model. And like last time, we will give an application of it. And again, like the health belief model, we're going to discuss how the Transtheoretical Model applies to COVID-19, vaccinations, and other ways to mitigate the transmission of the virus. We will move on then after that to the 10 processes of change, and finally we'll leave you with a personal application of the Transtheoretical Model. I also want to state, because of this little haziness, this little fog, I may be referring to my notes a little bit more, so I do want to thank you for your understanding and patience and cooperation with that. So again, background and history of Transtheoretical Model. Prochaska is the father and founder of this model. It originates from an analysis of 25 different forms of psychotherapy, and it is based in behavior change. It states that behavior change is intentional, that human beings are rational and can plan and have the ability to change their behavior. Also it states with these stages of change, they are fluid, they are dynamic. It is not that you do one stage, that's done, and then you move on to another. For example, if you go to contemplation, you move to action, that doesn't mean that you can't go back to contemplation. I contrast it to the life stages of a butterfly. So you have a butterfly, it can never go back, fold its wings and go back into a cocoon. It's a one and done stage, but that's not how it is with the Transtheoretical Model. Again, dynamic, very fluid, constantly moving. This model has proven to be very effective, very useful in 48 different health issues, very effective in such things as addiction, smoking cessation, disease screening, as well as changing behaviors in physical activity, as well as eating patterns as well. Now moving on to key terms and definitions. One thing we'll talk about is, and that you'll hear throughout this, is cost-benefit analysis. And I think of this kind of as the weighing of the scales when you're looking at adoption of new behavior. So you can also think of it as pros and cons. The cost is what you have to give up in changing a behavior, and the benefit is what you get from adopting a new behavior. And logically, the more you have to give up, the less likely you are to change your behavior, and the more you get and the more you benefit, you were more likely to change your behavior. So Another thing that we'll talk about is self-efficacy. We are going to define it differently than previous models and theories. It's constructed of two concepts, and I kind of like to think of it and visualize it as like, remember cartoon characters, and you have the devil on one shoulder and then the little angel on the other. So that's kind of how I visualize it when we talk about it. Again, made up of two concepts. We have confidence, which is, you remember, I talked in the health belief model, it's kind of like the little engine that could construct. It's the I think I can, I think I can, I think I can, even when it's difficult, even when that little engine's going up the big hill. I think I can, I think I can, I think I can. Again, it is that confidence. The second concept in self-efficacy in the Transtheoretical Model, which differs from the other, is that it's that temptation. So again, we've got the angel here, which is your confidence, and then you've got the devil over here, which is your temptation. And so that temptation is that you want to engage in behavior even when you know you shouldn't. So again, it's kind of like who wins out with self-efficacy. Okay, so now we are going to go into our constructs, the Transtheoretical Model. Again, these are the 5 stages of change. As I mentioned, we are going to relate it to COVID and the pandemic. There have been some studies as COVID relates, or as Transtheoretical Model applies to COVID. Most of them have been towards mental health, working from home, an international study of the intent of pharmacists getting the vaccine. I think this is important to investigate and research the behavior change because we are adapting to a new normal. I think that people have asked, like, well, when are things going to go back to normal? Well, it isn't. It's, I think if you are from a pre-9/11 generation, it isn't the same. We had to adjust to a new normal. So I think we are all having to really think about these stages of change. We're all going through them, and I think the Transtheoretical Model is really interesting to look at those behaviors. Okay, so the first stage of change is going to be pre-contemplation, and this is when we're not even intending to make any changes. From this model, there's kind of a timeline involved as well, and this is like 6 months. Some models don't even have a timeline involved with it, so sometimes it's kind of arbitrary and a moot issue. So again, this is not, you're not intending to make any changes. I think as it relates to the pandemic, this is before the pandemic, when we were thinking about other pandemics in its historical context. So maybe like smallpox and bubonic plague. So we maybe were never thinking like it could ever affect us. Maybe the only populations that were virologists, immunologists, epidemiologists. But for the general public, it never really occurred to us that this could affect us. So after pre-contemplation, you move to contemplation, and this is when you're just starting to think about the health behavior and the behavior change. And so as it relates to the pandemic and COVID-19, this might be when we started first seeing cases overseas. And they were isolated cases over there, but not really affecting the United States. And we might start thinking, well, what is life going to look like over there? We may be watching the news, consulting the CDC website, but really just, okay, it's over there. You're hearing about it, kind of thinking, but not really. You're not taking any actions, just ruminating. The third stage is going to be preparation. And so this is your intention stage. It's very strategic. You're planning. Few, if any, changes are taking place. And the changes that are taking place are incredibly preliminary. And I would say this would probably have occurred in like March 2019. And this is when everything shut down for 2 weeks, right? And again, this was kind of forced preparation. But, at this time, we may have been ordering masks, getting some sanitizer, stocking up on toilet paper for whatever reason, preparing for work at home, thinking about childcare, what that's going to look like, virtual schooling. But again, no major changes, again, because we were just going to be shut down for 2 weeks. And then the fourth stage is going to be our action stage. And again, this is when we're actually engaging in the behavior, and we are changing our behavior. From this model, from the Transtheoretical Model, it is said to last for about 6 months. Again, timeline, it varies. And also with the fluidity of this model, again, it changes. So in terms of COVID-19, during the action stage, we're starting to wear masks, we're getting our vaccines, we're getting tested. If we have symptoms, isolating as necessary, social distancing, starting to get in our little social bubbles, washing hands, not touching our face, which we should be washing our hands nonetheless. So that would be our action. Maintenance would be, we are continuing that behavior, and this is said to be 6 months or more. And I would say, and again, we're just continuing those behaviors. And I would say during this, we are adjusting to our new normal. Again, we are continuing the behaviors in terms of COVID-19, as I mentioned in the action stage. But we also may be starting to do at-home tests. Before and after social gatherings. We have hand sanitizers hooked onto our purse. We're getting vaccinated and boosted when we are eligible and they're available. We then have masks hanging on our rear view mirrors, so they're always prepared, we're always ready. So those would be examples of maintenance. So the last stage we have is termination. And some models say we may never even reach termination, because this is 100% confidence that you will never go back to an old behavior. So again, there's no temptation, you just are like, I got this. And as it relates to COVID, again, this is very dependent on the virus itself, so this is a little bit more of a complicated issue. And I would say, we have not reached the endemic. And I would say also most people haven't, because we have what's called COVID fatigue. We're tired of wearing masks, we're tired of getting tested and having to isolate. So I think that is kind of an example that termination has not occurred, but I think you can ask, are you getting boosted? Between 15 and not even, I think around 15-16% have only gotten their boosters. So then are you staying at home when you're sick? Or are you just like, I can go to work, it's okay? Are you wearing a mask when you have the sniffles? Are you utilizing home tests, or when the government's sending out free ones? Are you ordering those? And there are signs of termination. I think last week or the week before, Johns Hopkins dismantled their center for and website for COVID information. Last fall, St. Louis here also redistributed their resources that they had for the pandemic task force. They allocated those resources to other health issues. So that would be a sign of termination. But again, what are we doing personally? So those are going to be the stages of change. In terms of processes of change, there are a total of 10, 5 cognitive, 5 behavioral, and each one is associated with a stage of change. So the first, or we'll start out with the 5 cognitive and then move on to the 5 behavioral. The first is going to be increasing awareness. And that is going to just be the acquisition of knowledge. So you're gathering information regarding the health behavior and the behavior change. As it relates to COVID, researching the risk, prevention measures, you may be consulting CDC website, your local health department, as well as your physicians. And that's usually associated with the pre-contemplation stage. The second is also related to pre-contemplation stage, and that's going to be dramatic relief. And this is going to be the heightened emotional response that you have. It could be positive or negative. That's going to propel you or motivate you for behavior change towards action. So this could be a lot of times like personal accounts. So this could be listening to your friend's experience with COVID when they had it, like, oh my gosh, it was terrible, like I was down. And so that might be like, oh my gosh, like I need to get vaccinated, I need to do something. So that emotional response, that affective response, that's going to make you get it, or I got the vaccine and just my arm hurt a little bit. Okay, well, it wasn't that bad. Okay, I can do this. Again, that self-efficacy, that confidence, I can do this. And so you can go out and get vaccinated. Then we're going to move on more to another cognitive process of change, and that's going to be self-reevaluation. This is going to be during the contemplation stage, so that thinking phase. And this is going to be your cost-benefit analysis. So again, as we talked about, cost-benefit self-analysis. So this internal, intrinsic weighing of pros and cons. And this is going to be the presence or absence of a behavior, the cognitive and affective perspective from a self-analysis view. And from this, it would be like, does getting vaccinated or, wearing a mask, like, what does that look like for my self-image? And does getting vaccinated, does that align with my value system? So those are questions that are going to be asked during self-reevaluation. It's that internal intrinsic reflection. And then we're going to have next, also in the contemplation phase, is going to be the environmental reevaluation. So this is going to be to the environmental cost-benefit analysis. So this is going to be outward. This is going to be, how do my actions affect others, affect the environment, the presence or absence of this behavior, how does it affect others? So, if I get vaccinated, how does this affect those around me? If I don't get vaccinated, how does that affect others? And I would argue that self-reevaluation as well as environmental reevaluation are very interrelated. They're very connected, because if you say my value system is very altruistic, I care about others, then that is going to, I care about others, then my self-image, I need to take care of others, I'll get vaccinated. So again, very interconnected. And if you don't, there might be some cognitive dissonance going on. So I care about others, but I won't get vaccinated. So again, that would be some cognitive dissonance going on, and she would have to realign those somehow. So the fifth, which is going to be the last of the cognitive process of change that's going to be associated with the action stage, is going to be the commitment and recommitment. So this is going to be that you're acting on the belief that you can change. So it's the commitment and recommitment that you can act on the change. So the example that the book gives is New Year's resolutions. And I would say for COVID-19, it would be getting vaccinated and getting boosted. So it's continuing that behavior. You're getting vaccinated, you're getting boosted, you're masking. So it is that commitment, recommitment. You're constantly evolving with that behavior. Okay, so we're now going to move into the behavioral processes of change. The first of those would be helping relationships. This is going to be associated with the maintenance stage of change. So these are going to be your positive social networks that encourage your healthy behavior. So these people will be support you getting vaccinated, wearing masks, and I would argue that even if they don't believe it, even if they're not for it, that they would still encourage you and still support you. For example, I'm immunocompromised. I have some friends who did not get vaccinated, but they very much respected my belief for getting vaccinated. And I said, hey, if we hang out, it needs to be outside, and I need to be masked, and you need to be masked. And so they very much supported the need for my healthy behavior. So again, even though we may not have seen things on the same level, they were still positive in supporting my behavior. The next behavioral process of change is going to be social liberation. And again, this is going to be in the action phase. And this is going to be an increase in healthy social opportunities or alternatives. And so again, this would be like taking a walk outdoors instead of meeting inside. So that would mitigate the risk of the transmission of COVID. So that is one example of social liberation. Counter conditioning is also in the maintenance stage, and also behavioral process of change. And this is learning healthy behaviors that take place of unhealthy behaviors. So I would say that this would be designating a shopper per household. So that way, someone can stay at home with the kids. You can use Instacart. So that way you are decreasing the exposure of transmission of the virus. So I would say that would be an example of counter conditioning as it relates to COVID vaccine. Stimulus control is also next on our list to discuss, and that is also maintenance. And this is removing cues or prompts that lead to unhealthy behaviors, and you're going to replace it with a healthy alternative. So, during the pandemic, we saw a rise in alcohol consumption, and so due to isolation. And so, one thing would be to get rid of the alcohol and maybe replace it with your favorite sparkling water. I love black cherry Waterloo. So get rid of the whiskey, put some Waterloo in there instead. So our final behavioral process of change is going to be reinforcement management. And so these are going to be incentives or ways to encourage positively reinforce healthy behavior. And it could be you're rewarding the behavior or others are rewarding that behavior. An example, when I got my vaccine at Walgreens, they gave me like a $5 coupon to use in the store. I think the state of Missouri allocated $11 million in gift cards to give out to those who are vaccinated. So those are really great examples of the way incentives and reinforcement was used to increase that behavior of getting vaccinated. So we're now going to move on to the strengths and weaknesses of the Transtheoretical Model. So it is a very cool model because it's very fluid. It really addresses the why, how, and when behavior takes place. You can very much tailor it to the individual and what stage they are in. And you can use it for a wide range of behaviors and settings. And like I mentioned when we first started out, that almost 50 behaviors that it has been used for. So it is effective as well. The weaknesses is that we are relying mostly on self-reporting for both information gathering, needs assessment, and so we are assuming that people are unbiased and objective in their perspective of themselves, which sometimes that's not always true. And so looking at long term, it's kind of hard to determine the long term effects because sometimes people drop out of studies. And questions: can we skip stages? Do you have to always follow this order, or can you skip stages? And it's also sometimes difficult to define stages, and are stages kind of arbitrary? Do we need to put a stamp or a label on them? And then also it's assuming that everyone is rational and that they have the ability to make decisions. One thing that's lacking in research is the effectiveness on childhood and adolescence in terms of change in behavior and health behaviors. So that's one thing that needs to also be addressed. So as I leave you today, I'm going to leave you with a personal application. So as you have been experiencing the pandemic, how have you gone through the stages? What stage are you in now? What stage did you get kind of stuck in, or have you been transitioning through stages? So I'd really like to leave you with that, something for you to think about. And then I will see you in 2 weeks when we discuss social support and social networks. Thank you so much and have a good day.